to the Day Exchange podcast. In today's episode, we are talking about HIV and AIDS. I'm your host, Wes Pili, and our guest is
Yamikani Lekan.
welcome.
I appreciate for inviting me here to this interview.
All right. What does HIV and AIDS mean?
So as you can hear, it's there's and there. So there's no way I can define two things in one definition. So as such, I am going to divide the definitions. Let me start by defining what HIV is. HIV simply means human immunodeficiency virus. Look, you should hear me properly. I'm saying good is human immunodeficiency virus. There are English words in this definition. First of all, there's human. Human is you and me. It means this thing affects only human beings. Immunodeficiency. It means there is a reduction. Okay? It depletes immune system of human beings. Immunodeficiency. Virus is the causative organism. So it's an organism that attacks human beings, and it reduces or it depletes immune system. Then when we say AIDS, we mean acquired immune deficiency syndrome. So when I say acquired, no one is born sometimes, but it's not naturally found in an organism, in a human being. Someone has to get it from someone. Okay? So yeah. And immune deficiency I have already explained. Now syndrome, when you say syndrome is just a group of signs and symptoms when they are combined together, they lead to certain diagnoses or to certain diseases. That's the definition of a syndrome. So the group of signs and symptoms, when they are grouped together, they guide towards certain diagnosis. Yeah, that's the definition.
All right. What is the epidemiology of HIV and AIDS?
Okay, so HIV and AIDS is one of the common thing in our setting. So it's common in age groups of 20 to 30 years. So it's us, this our age group. HIV is common in our age group. This is the period where most people get HIV. I think for obvious reasons. This is the time whereby we become sexually active. This is the time where you tend to test a lot of things. Okay, so it's common among these 20 to 30. It's about 35 people out of every 100,000 people have HIV and AIDS. Yeah, and it peaks around 45 years. So you find that majority of people who have HIV and AIDS, they peak around 45 years. So there's no significant there's no racial differences in terms of HIV and AIDS. It affects every race, whether we black Africans, Americans, whites, whatever, Asians, Europeans, all these people can be affected the same. Okay, so I can say globally, the entire world, about 37 million of people throughout the world are HIV positive. Okay?
Yeah.
Basically, that's the epidemiology.
All right. What are the signs and symptoms of HIV and AIDS?
Okay. Some of the signs and symptoms of HIV and AIDS. they are not really specific, but someone who has HIV and AIDS may have fever, prolonged fever, fatigue, like muscle pain, okay, bone pain, joint pain, headache, prolonged headache, generalized tender lymphadenopathy. So sometimes they have enlarged lymph nodes. Lymph nodes in Chichewa we call them mwanabere. So they have enlarged lymph nodes. Alright. So sometimes they may have generalized rash. Kuyabwa. Mango yabwira batu people. Sometimes they have prolonged diarrhea, nausea, vomiting. Sometimes they have unexplained weight loss. When I say unexplained weight loss, I mean someone is just losing weight without no known cause. They are eating properly. They are not being depressed. They have money, but they are losing weight. Sometimes it points towards HIV. Sometimes they may have sore throat, mabala, kukos. Sometimes they may have ulcerations or pain swallowing, ama futika kutea message okuja. So sometimes a patient may be asymptomatic. What I mean is, you can be HIV positive without showing any symptom for up to 8 years. So all these years you are just enjoying. You'll be like, I'm fine. Okay, by the time you are married now, or by the time you want to get married, and then someone is saying, okay, before we get married, we need to go for HIV testing. That's where they find you positive. And you should think of, would this guy angavomeruka now will be positive? Okay, so sometimes they may have opportunistic infections like oral candidiasis. Yeah. So basically, those are presenting complaints of people with.
Okay.
Yeah. So HIV and AIDS is in stages. There is stage 1, stage 2, and stage 3. I think the stage 1 and up to stage 4. Stage 1 is whereby a person is not showing any signs and symptoms. And this can take up to sometimes they may be asymptomatic, or they may have flu-like symptoms, or they may just have lymphadenopathy, like swelling of the lymph nodes. Uh, but you cannot tell that this person may have HIV. But it's a stage, first stage. Second stage is whereby is whereby a person is having persistent, generalized, unexplained moderate weight loss. They're just losing weight. Okay? Yeah. So this stage is stage 2. Stage 3 is whereby they have unexplained weight loss. They're just losing weight without telling what is causing this weight loss. And sometimes they may have age-defining condition. So when I say age-defining condition, these are the conditions whereby when someone is having these conditions, we suspect that they may have HIV. So, for example, cancers of skin, like Kaposi sarcoma, yeah, and presence of pneumonia, chibayo. Chibayo sichipezeka mwa muntu wankulu mwachibwanabwana. It's a sign that a person's immune system has been lowered. So those are basically presentations.
Alright. How can HIV and AIDS be transmitted?
Okay, so transmission is through someone being contact like being in contact with a infected blood. For example, how can you be in contact with infected blood? Through sexual intercourse. Sexual intercourse, it involves friction between the sexual organs whenever people are having sex. So that friction sometimes it causes it irritates the skin, whereby it can cause bleeding. So if you are bleeding and the boy is bleeding again because of the friction, you can easily share blood. That's why it's the common way. The other ways are like sharing of sharp objects which have been used. Okay.
Mm.
Yeah. For example, we are sharing. You have just used a needle and you have pricked yourself and you're HIV positive. If I take the same needle within 5 minutes, and if I prick myself with the same needle, I will get HIV. Yeah.
Mm.
And that's some of the ways are through mother to child transmission. Maybe you have been hearing some situation whereby a child is born with HIV. Yeah, it happens. They may get HIV either during pregnancy, during delivery, or during breastfeeding. It's possible. And the other way is through blood transfusion. I think it was I have forgotten the year whereby the Malawi blood transfusion service started testing for HIV and hepatitis B in blood. Sometime back, they were just getting blood from anyone and transfuse it to other people. So they were transmitting HIV. Let's say you have HIV and they have gotten blood from you to give it to me. It means I have just gotten HIV in a simplest way. So that's one way. And the other way is those people who inject themselves with drugs. Let's say I'm injecting with myself with I don't know, those injectable drugs, and then we are using the same needle. You can use the And the other group of people are those people who have sex with men having sex with men. The anus is not as flexible as vagina. So you insert your penis there. That anus cannot really relax as the way vagina is. That area is it's a little bit hard, but you force your penis through that anus, you can easily cause tears and it transmit HIV. Actually, that's the topmost group of people who transmit HIV and AIDS. Maybe people having sex with mahure. Sure.
All right. What is the development?
Of HIV and AIDS?
Yeah.
Okay. So basically, uh, uh, development when you have contacted the CD4, I mean you have contracted the HIV, it goes straight into your blood. That's where it says, especially in your white blood cells, known as CD4 count. I mean, known as CD4. So your red blood. I mean, your white blood cells, especially helper T cells, they have a pigment which they call CD4. So HIV likes this pigment of blood. So when it enters into your blood, it goes to white blood cells and they destroy this CD4 uh, component of white blood cells. So if this CD4 is also the one which is responsible for fighting against different organisms whenever they get into your blood. So let's say this CD4 has been reduced. It means any infection which gets into your body is not going to meet any resistance. It will easily infect you and you'll be able to suffer from anything. That's whereby a person with HIV and AIDS is able to suffer from a lot of infections and a lot of cancers because they don't have soldiers in the body to fight those organisms. Why? Where are these soldiers? They have been depleted by HIV. So that's where you hear kuti chitetezo chawo cha nthupi ati nchosika kwambiri. It means their immune system has been lowered by HIV itself. Basically, that's the development of HIV. And when a person has developed these opportunistic infections, we say they have AIDS. So it means they have a syndrome of a lot of diagnosis. Yeah.
What is the diagnosis
Yes.
of HIV and AIDS?
Okay. So we do test. Let's say diagnosis. The way we diagnose people with HIV and AIDS, we use their tests. We normally take blood. We use blood. Okay, and we use blood. So in this blood, what do we check? We check for HIV itself. Sometimes we check antibodies, which are HIV specific or non-specific. Okay, so we take a blood sample, we put it on that on a certain strip. It meets some reagents there. The presence of HIV is shown by two lines. When you're HIV negative, it just shows a single line. So basically, that's how it is done. But so far, guidelines are saying that anyone who is sick and has been admitted to hospital are supposed to be tested for HIV. So if you are sick today and we admit you in hospital, whether you want it or not, we are going to test you for HIV. But if you say you don't want, we don't force anyone. You can be spared. But whatever happens, we are not responsible. We are going just to treat whatever we have found. Let's say we have found that you have meningitis, and we know you can be HIV positive. We just want to confirm through test. If you say no, you don't want to test, we are going to treat our meningitis. If you're not going to get okay, if you're not going to get treated, it's not our fault. We are going to give you somewhere to sign. I don't want HIV test. I just want them to treat me for meningitis. We are okay. If we diagnose you we diagnose you with TB in the hospital, we need to know your HIV status, because most TB occurs in people whose their immune system has been depleted. So if you say no to our HIV test, we will say okay. Okay. Yeah. So the other way we do is we do what we call community testing, whereby we go into different schools, into different communities, into different occasions, mobilizing people to get tested. That's also another way. It's voluntary. The other way is when a person is feeling that I feel like I'm not okay in my body. I've been trying painkillers. Let me just go and test. And today I have met a patient in the hospital who told me that I think I was just feeling weak. So I decided to go to hospital to get tested, and I was found positive. Now I'm on ARVs. You see, she decided herself, I'm here, I want to know my status. Because I've been feeling weak for a long time. It's not improving with painkillers, and it's becoming wet. It's becoming worse. And also I'm losing weight. I want to know my status. And she was found positive indeed. She's now happy with her ARVs. So why are you not coming today to hospital? I want everyone today who doesn't know their status to come to hospital and get tested, if in US. Okay?
Yeah.
Yeah, that's how we diagnose people.
All right. What is the management?
So the management for HIV is the mainstay management is ARVs. It's ARVs. Okay. So before we start someone on ARVs, there are other tests which we do. We don't just rush to give someone ARVs. We need to run other tests which are going us to exclude some of the uh, opportunistic infections. Like maybe a person may have TB, meningitis, or like inflammation of the coats of the brain, like the membranes that cover brain, the inflammation of these membranes called the meningitis. So if the person has meningitis, either from TB or other organisms, we don't start them on ARVs because we avoid exaggerated immune boost, which is also a problem to the patient. So we wait. If it is cryptococcal, uh, this one is a fungi. It's a common one which causes meningitis in people with HIV. So if it's cryptococcal, we treat the patient. We start the patient on ARVs in week 5 after we have started them on other medication for this meningitis. If it is TB, we start them on ARVs after 2 weeks because there is no harm to start them on ARVs earlier uh, than the cryptococcal one. If it is if the patient has no meningitis, we start them right away on ARVs because we have nothing to wait. But still, if the patient doesn't look to be in, if the patient doesn't look fit, we don't start them on ARVs too, because ARVs has its own side effects. So if the patient is already weak, very ill, they can easily die. So we start by treating whatever condition which they have. Then we go on to do the to treat the to give them ARVs. They don't just take ARVs. We also give them Bactrium. Bactrium is going to cover for possible meningitis, for possible pneumonia in future. Sure. So basically, that's how we manage it.
All right. What are the complications of HIV and AIDS?
Okay. So you have asked about the complications of HIV and AIDS.
Yeah.
Mm, one of the complications of HIV and AIDS is they may develop what we call exaggerated uh, immune boost. So I've just said this in layman language, but in our language we call it immune reconstitution. You get it? Immune reconstitution, inflammatory system. It's a condition whereby there's just too much boost to the immunity of an individual, which is also of a problem to an individual because immunity needs to be improving slow by slow by slow. I mean, slow but sure. But when it's too much, it can also kill a person. Yeah, basically. And the other challenges of HIV, it affects an individual itself because most of the time they're going to be in hospital. And also it causes other opportunistic infections and other malignancies, cancers. Even it also affects the family because they cannot participate in their daily lives. They need to take care of this patient in the hospital, take them to hospital to receive medication, take them to hospital for checkup and the like. And also the nation, they're going to lose a lot of money to buy ARVs. Okay, so either way, HIV has a very bad impact uh, in an individual, the family, and the nation. Yeah.
All right. What is prognosis of HIV and AIDS?
Okay. Um, so about if the HIV is not untreated, so if it's not untreated, people can die within 8 to 10 years. So if you have HIV and you are not being treated, you can easily die. So you need to be on medications. But prognosis lies like the progression of the disease from latent phase uh, depends on individual by an individual. Like certain individuals develop in like certain individuals can and even survive up to 12 months without being on ARVs after the symptoms have started. They can go up to 1 year without even dying. But some people cannot even reach 2 weeks. Yeah. So it depends. I should just answer this way. It depends on a person's CD4 count. Chitetezo mutani thupi. A person's whether the person is in ARTs or not. Presence of opportunistic infections and other HIV defining malignancies. All these contribute to prognosis of HIV. Yes.
What advice would you like to give those who have HIV and AIDS?
These people, basically, they need to prevent spreading HIV to other people. In the people say, I got this from someone. I am also supposed to share, but that's a bad thing because if I find that someone has given me HIV and they didn't tell me that they're HIV positive, I can easily sue them. I can easily sue them to court because they have killed me. They knew that they are just HIV positive, but they didn't want to tell me. That's a bad thing. It means they have killed me. So you need as much as possible. Whoever comes to you to propose to you, tell them that I'm HIV positive. Because when they discover later, it will be like suicide thing or killing. And also, they need to take their medication properly. If you're taking your medication properly, you will live your life. No one dies from HIV these days. People can live up to 60 to 70 years with HIV if they are taking their medication properly. So that's how I would advise the people with HIV.
All right. Thanks for your time.
Thank you so much.